thoracic cavity. I'm going to work on exposing the vascular structures in the abdominal pelvic cavity. And to do this, you're going to have to turn your pig onto its right side and pull, gently pull things off to the right. Follow that white structure that is, it's white in mine, it's pink if it's well injected in others. Follow that nice white thoracic aorta to the diaphragm. And you know it's the diaphragm because it's connected in the back. And there's still some diaphragm connection at this stage. Let me rotate just a little. And you can see this right here. It's in our way. So this is, again, where you're very, very careful. This, I can tell, is just membrane, peritoneal lining. But this right here is diaphragm muscle. I'm putting a little bit of my sharp end in here, cutting through, snipping a little bit more, snipping a little bit more. If you'll notice, I'm trying to stay dorsally as I make these cuts to that aorta. I'm not trying to go too much to the side or to the ventral, to the lateral aspect or to the ventral aspect of that aorta. You see how I did that? I was able to cut that diaphragm away to where now I can see the length of the aorta as it's passing through. And just one more little snip, I think, or two. Yeah. I now have the diaphragm removed from that. There's going to be some glands, lymph glands and adrenal glands, but that's okay. What's nice is you can actually see this aorta running down the entire aspect of the thoracic cavity, going through the diaphragm, now in the abdominal cavity. The aorta is called the thoracic aorta here, and now it's called the abdominal aorta, so we know where we're talking about. What you have to do, so you've done that, there's going to be some blood vessels coming off the aorta that's going to supply the muscles of the lumbar area. Those blood vessels are called iliolumbar. They're not well injected here. I want you to cut them, though. They're going off to these strap muscles down that area. So you cut those, and then in doing so, I'm trying to rotate so you can see internally. Here's your kidney. You can actually see, finally, we've got some pink injection. You can actually see the renal artery as well as the renal vein. Now, that is one structure you're supposed to definitely identify coming off of the abdominal aorta. But the very first aortic structure you're supposed to identify is the celiac. It is all by itself, and it's on the ventral surface of the abdominal aorta and right immediately below the diaphragm. So we cut the diaphragm here, so that celiac is going to be right immediately below that on the ventral side. Next to that is the anterior mesenteric. And so they are just right next to one another, and as I pull things to my right, I'm going to work on seeing if I can find a solitary structure. I'm going to use my blunt probe now because I'm afraid that I'll tear it. A solitary structure. Ah, I'm beginning to see something. Okay. There's something there, and there's something here, and it looks blue. And that might be because of the injection technique on this pig. You cannot depend upon it. So we've found our aorta. We have found the celiac, and it's pink or blue at this stage. I can't quite tell. I'm not going to dissect it further at this time. I just want you to see how I located it right by where the diaphragm was. And there's still a little notched diaphragm on the opposite side. The next one is the anterior mesenteric, then we have our renal, and we're following our aorta on down. It's giving off little branches to the back called the lumbars, just so that you know. And you just start to take your blunt probe, pushing tissue away from things. Remember your ureters. Don't get rid of those. And also, I'll do a flip here. Here is your rectum, and there is a posterior mesenteric that's going to be feeding this structure here. This is your rectum. So I'm going to keep things on the side here. Follow this structure on down until you can appreciate that this umbilical artery is going right into, or coming from, shall we say, the aorta. So can you see this connection right here? There is a branch that is going off to the thigh bone. That branch, when it first comes off, its name is the, I'll move some of these lymph nodes out of the way. Its name is the external iliac, I-L-I-A-C. It's the external iliac, and that's going off into the thigh. It's different from the small intestinal word ileum, I-L-E-U-M, because I-L-E-U-M is associated with the intestines. I-L-I-A-C is associated with a part of the bone of the thigh called the iliac crest. It's actually part of the pelvis. But if you follow this branch here, you will actually see that it divides. And I want you to do that. Follow it as it divides, saving the divisions, following out the divisions until you come to what branch looks like it's going off to supply the thigh bone or your femur bone. And in this specimen, it's going to be this one here. It's going to be the femoral. So you have femoral artery and femoral vein right here. Got a little muscle when I pulled that up. But you'll follow that out a little bit more with your own specimen. So we have umbilicals, we have external iliac, we have femorals. As I rotate and I look into the pelvis of my pig, coming off of the umbilical artery will be the internal iliac. Because if the way blood vessels are named, if there's an external, there's always an internal. This specimen does not show it real well, but the internal iliac is right in this area. I'm going to show you this with a different specimen, but it's diving into the pelvis, and it is much thinner, and it comes off of your umbilicals. So that is how to uncover that, those structures in that area. And as far as the posterior mesenteric, when you're flexing around down in this area, push the rectum this way, and you actually will see the posterior mesenteric, which is as small as the internal iliac. Do you see those two little branches coming off right above my probe, right anterior to my probe? That is the posterior mesenteric. That's how small and skinny that one is. So it's all around where all these vessels are coming off, and it actually supplies the rectum. So that's why I say pull the rectum off to the side too in order to expose that.